Healthcare lately has been demanding of all of us that we come up with innovative and new paradigms to deliver care so that we can meet the demands that healthcare reform has delivered for us. And at the same time, make sure that patients get good care with great providers and get that care timely.
We elected to go with the telemedicine hospitalist program. We are able to continue to serve patients in our community, provide the best care possible, and keep patients home while collaborating with other hospitals that are like us.
The technology and the idea of delivering care through telemedicine has been around for a long time. I myself used to use this in Florida during one of my first practices 25 years ago when we had a huge room with a huge machine that I had to stop the entire emergency department to bring the patient in and go through a lengthy process to deliver the care. Since that time, the machine is smaller, it's more affordable, it doesn't interrupt my practice, and the patient experience is much better. So yes, we've been doing telemedicine a long time, but not this way.
Having that collaborative care team, our nursing staff have been able to continue their cycle of learning. They feel very comfortable having the relationship with providers that they can call at any time, giving updates about changes in patients' condition. It has absolutely improved the relationships between nursing staff and providers, and it has absolutely provided the best quality of care to our patients possible.
The actual time that the physician spends with the patient has been at least triple what the national averages are at the bedside. We found that because the data is actually at the fingertips of the provider in the setting that we have in the telemedicine service center. And we also found that within seconds, the patient forgets that the doctor's on camera, and we hear from our physicians that within seconds they forget that the patient's on camera. And it just becomes a very human, very audible, very high quality interaction where all of the other trappings that people may have worried about go away.
Single most important benefit that we've seen in nursing services since implementing the telehospitalist program has definitely been the relationship building between the telemedicine physician in the service center and our nursing staff on the night shift. They are rescuing patients sooner. We see fewer codes. We see fewer rapid responses because our patients are being taken care of quickly. We are doing clinical interventions more promptly because nursing staff feel like there is always someone available who is ready to work and ready to listen.
So for example, that you get a call on, a regular chest pain. There is so much more you can do with this technology than just answering it on the phone. You're there in real time, you can see the patient, you can look at the labs, you can see the EKG, you can be in direct touch with the family and the patient. And that I can't think of anything more hands-on to give you a longer and a more efficient face-to-face time with a patient. And that's probably going to be the core methodology of healthcare getting into the future. It's the new wave of medicine, and I want to be a part of it.
If a patient deteriorates in any way in the middle of the night, for instance, the patient's pain medicine is not holding, that's no longer a phone call. There's no delay in care. That actually becomes a physical exam where the patient is examined by a physician. They can be completely evaluated. There is no disconnect between the care team and the patient's needs are met immediately.
These hospitals had trouble delivering the kind of care they needed because providers were in short supply, and they actually did not have a dedicated hospital medicine service at all. They had local medical staff that were taking care of their patients and then having to go to their practices days and nights and weekends as well. So it became quite a burden to them and risked burnout of their local staff, which the hospital depends on. In summary, the patients love this because they don't have to be transferred as often to another facility. They can stay in their own community, and their families love that. Their doctors in the community love it because they know what's happening right in their own hospital and they're back in the office as soon as they can be. Our doctors love it because they get help, much needed help with the demands of a very busy hospital medicine practice. And we love it because healthcare, if we're to be part of the future, needs people that will innovate and be steadfast about producing new solutions for patient care that dearly needs it.